For our next video lecture on immunosuppressant drugs, we'll be looking at primarily Cyclosporine A, but also a little bit at Tacrolimus or FK506 due to the fact that they both have an overlapping mechanism of action. Both of these drugs are used primarily for prevention of organ rejection post-transplantation. And the really interesting thing is that both of these drugs are very much structurally different. Cyclosporine A is a fungal metabolite, whereas Tacrolimus is a macrolide. Now, normally what happens is we have an antigen-presenting cell, such as a macrophage or a dendritic cell, which presents an antigen through an MHC marker and binds onto a T-cell receptor and also a CD28 receptor, leading to activation of calcineurin, which is a serine threonine phosphatase that dephosphorylates NFAT, allowing it to translocate into the nucleus and lead to transcription of genes that lead to production of IL-2. IL-2 is a very important cytokine that leads to clonal expansion of T cells. The way in which these drugs work is twofold. For FK506 or tacrolimus, it binds onto FK binding protein, and for cyclosporine A, it binds onto cyclophilin. Both cyclophilin and FK binding protein inhibit calcineurin. By inhibiting calcineurin, it can no longer dephosphorylate NFAT, and therefore NFAT cannot translocate into the nucleus and lead to expression of IL-2. It is important to note that even though here I only show that these drugs inhibit the pathway that leads to increased synthesis of IL-2, that these drugs will also lead to decreased synthesis of tumor necrosis factor alpha, also decreased synthesis of GM-CSF, and also decreased synthesis of other cytokines. Cyclosporine A has many adverse drug reactions. One that we've commonly seen in other lectures is opportunistic infections, which is an infection that a normal healthy person wouldn't get or is abnormally severe. Classically, and a really important one that you should remember, is nephrotoxicity, which can lead to hypertension. Cyclosporine A can also lead to gum hyperplasia, can cause skin cancer, seizures, and neuropathy. Now we're going to look at the clinical pharmacology of cyclosporine a little bit. Cyclosporine has erratic oral bioavailability, and therefore we administer it in an emulsion formulation. It is really important to note that a clinician has to monitor the blood concentration levels of cyclosporine A when administering it. Another really important thing to remember is that if a patient drinks grapefruit juice, it will inhibit CYP3A4 in the intestinal epithelium, and therefore by inhibiting this enzyme will lead to decreased breakdown of cyclosporine A and increased levels of cyclosporine A in the blood, and therefore can increase the risk of getting an adverse drug reaction. Thank you very much.